The following are the 5 basic communication skills that doctors use to encourage and support any behavior change. These skills may be used in a variety of manner by the doctors while encouraging lifestyle changes. These are some competency skills that every doctor should have. An essential of good communication is to quickly build up a rapport with your patient. Eye contact, facial expression, and posture is important. A doctor needs to invite honest and free discussion with the patient in order to establish a trust and a partnership with the patient. Lecturing patients is often ineffective in encouraging behavioral change. It usually either closes their mind or makes them defensive.
Good morning, doctor.
Good morning. Please seated.
Doctor, I have a problem that appears to be becoming worse.
Okay, tell me, what is the problem?
I'm having a bad cough and it is difficult for me to do my work. I'm working in construction and we need to be strong.
Yes, how long have you been having this cough?
About 5 weeks.
Okay, tell me the symptoms you're experiencing.
At first, I thought just a cold due to climate change, but then it became cough, and the cough continued and became worse. Sometimes it even difficult for me to breathing.
Let me examine you. Breathe deep. Your chest appears congested. I can see cigarettes in your pocket. How many do you smoke in a day?
Not that much, doctor. Half a packet now. Actually, since my illness, I reduced a lot.
Have you all noted the non-verbal cues and the honest and open discussion between the doctor and the patient? Open-ended question encourages a patient to give an answer which is more than yes or no, in detail, and also to reflect on their own conditions. If a patient is unable or too shy to respond to it, why don't you all give some choices or answers to them to which they can respond to? You will use both closed and open questions in your practice. For example, you may ask a question, "Do you smoke?" which would give an answer yes or no. But following that, you can ask a question, "Can you tell me something about your smoking habit?" This will give you a little more detailed answer from the patient. A doctor needs to prompt a patient to provide more information in order to clearly understand his issue. If a patient says something vaguely, it may be misunderstood by the doctor. So by clarifying an issue or asking a question clarifying the issue, the doctor will allow the patient to reflect more and give you a clearer insight into the issue.
I heard you say that you want to quit smoking because of your children. Will you tell me more about that?
In the above case, we want to know what is the motivator. Is it the effect of the secondhand smoke on the child? Is it that the parent is becoming a bad role model to the child? Is it the cause factor? Is it shame? Or is it that the child himself or herself may start smoking? Restate or summarize as accurately as possible whatever you have heard from the patient. By doing so, you will highlight the important points and organize the scattered thoughts into a clear scenario. This will be heard by the patient and they will be able to reflect on their position. After reflecting back to them, always ask, "Am I right?"
I cannot quit smoking, doctor. All my friends smoke. We take break together at work. I can't say no when they offer cigarette. It's our routine as friends.
So what you're trying to say is that you feel compelled to smoke because your co-workers smoke. You would feel embarrassed or left out if you don't join them. Do I have this right?
Yes, doctor, you are right.
Reframing statements provides the patients another way of looking at their smoking or quitting attempts by providing a healthy or a positive way of assessing them. For example, some patients may feel negative about their quitting attempts or about the relapse while they had attempted to quit smoking. But this can be provided back to them as a positive as lessons learned in an instructive manner. By reframing, you help them to rethink their behavior in new ways.
I only quit smoking for 2 weeks and then I started again. I failed to quit.
You quit for 2 weeks? That's a very positive step. The first 2 weeks are the most difficult in the quit response. Let's discuss the factors that led you to relapse, and let's identify the challenges that you faced. Then together we can figure out a strategy and see that you're more successful next time. To begin with, let's see what kind of lessons you've learned.
This type of reframing opens the door to a second quit attempt, knowing all the hurdles they went through in the first one.